Hello and welcome to Wellness Wednesday Live. And we are live here in the Zoom room, but we had a little bit of difficulty going live on Facebook. We will upload this, so you're watching the replay, but I am happy to be here with Dr. Samuela Manages, and she is one of our Pines Health Services providers. And we are talking about mental health awareness this whole month because it is National Mental Health Awareness Month. And so you are a provider in our family practice. Do you work mostly out of Van Buren?
Yes, my main office is in Van Buren. And thank you, Bethany, for inviting me to take part in this discussion during Mental Health Awareness Month. My practice is in Van Buren, but I also work with AMHC in Caribou through the Suboxone MAT program.
Awesome. Well, primary care doesn't just involve taking care of acute physical illnesses or well checks, right? I mean, it really does incorporate a lot of different health and wellness initiatives and issues. So how common are mental health related issues in practice?
Mental health is very common in our practice, and we take care of patients on a regular basis. For example, with depression, anxiety, PTSD, bipolar, and other mood disorders, as this can also impact their chronic medical conditions.
So can mental health concerns lead to physical health impacts, or is it just usually, sometimes when we're dealing with those mental health issues, people are just saying, oh, it's in your head and you don't have to worry necessarily about feeling physical impacts?
Actually, it does significantly impact our physical health. We use a biopsychosocial approach to taking care of our patients. For example, I'll give you the example with diabetes. If someone with depression has diabetes and their depression is not controlled, they have depressive thoughts, they have poor concentration, decreased appetite, or unable to eat, they're not able to sleep. This can actually impact them taking their medication to control their diabetes. And then what we'll see in the office is patients will come in and we see their sugars in the 200s. But if you just focus on the numbers and say, oh, your sugar is high, let's adjust your medication without, just going a little bit further and asking, how are things at home, or how's your mood, just to see if their depression is not controlled. Then you will still have an issue with not controlling their diabetes because their depression is not under control. So you do have to address both because one do affect the other.
Wow, that's interesting. And in this current environment, really, we're worried about the spread of this disease and this virus, and germs and contagiousness can be a huge concern just in this normal environment, abnormal current environment. So how has that contributed to worsening of symptoms for those people who might be dealing with some mental health diagnoses like anxiety, or you had mentioned earlier in some of our discussions, OCD specifically?
Right. OCD is actually an anxiety type disorder. And, now with COVID, it's the fear of, contracting this virus. We have done, a good job in making sure everybody stays safe and, everyone's following the guidelines. Unfortunately, a lot of individuals have lost their jobs. Their finances are not where it used to be. And with COVID here, it does increase anxiety. If patients are not able to, be able to afford their medications, that can also have an impact. You did mention OCD. Now, OCD is an obsessive compulsive disorder. With COVID going on, it does magnify the symptoms. For example, there are different types of OCD, and one of them that you mentioned is with contamination. So you have the compulsion part of OCD where patients are constantly either washing their hands more than usual or cleaning down. And the compulsive behaviors can interfere with, uh, with relationships. It can interfere with daily function, uh, where patients are not able, they're not able to function because the compulsion can go on for hours.
That's so scary. And it's got to be really even more so in this environment, where there's this, unseen virus, and you don't know where it is. We're assuming it's everywhere in our communities. And, when you're living with that fear and having it amplified in such a way, wow, that's got to be really difficult.
Yeah, like for example, they tell us, wash your hands for about 20 seconds. Don't touch your eyes, your nose, or your face. But somebody with OCD, and if they have the fear of, contamination, instead of washing their hands for that 20 seconds, it may be longer than the 20 seconds. They might have family members, if they come into the house, have them change their shoes, change their clothes, just a little bit more excessive behavior that we will normally not do.
So how are you addressing this with these patients? What are some suggestions that you're giving them during this time when they're struggling and potentially having more symptoms than they normally would?
Well, what we typically do is first and most is social media. I know there are a lot of informations out there, different organizations, conspiracy theories. I would recommend that you stick with one organization or one source for your information and don't spend a lot of time on there, because if you notice, the information is repetitive. You go from one news station to the other. It's the same thing, but they might say it in a different way, or they might add, things here and there. All you need to do is pick a source. It's good to see the main CDC website or the national CDC website. Another source of information is your mental health provider or your primary care provider. They could be able to guide you, to the right resources. The other thing is take time out for yourself. Go out for a walk, whether it's 10 minutes, 15 minutes, put on some good music, do the social distancing. If you know you're going to be in a crowded area where you can't social distance, of course, carry a mask with you. You can do yoga in your home. There are a lot of videos online. You can do that. And I would say take a break from the multi-social media platforms, because just reading that not only entice and increase your anxiety, but the information are incorrect. And if you are listening to a lot of incorrect information, then that ramps up your fear. Other things we can do is cognitive behavioral therapy. We have amazing behavioral health providers, not only at Pines, but the neighboring organizations like AMHC. There's also Life by Design, to name a few. They can reach out to their mental health provider or contact the primary care provider for a referral. Other things they can do is, of course, exercise. You can do jogging, you can do yoga, massage therapy. Unfortunately, massage therapists are not open yet, but once they do open, that's another source, for some relaxation. We do have medication treatment for OCD. The class is called SSRIs. An example is Zoloft, or there's sertraline. They work pretty well, but a combination of the cognitive behavioral therapy, the counseling, and the medication will help patients get through this, whether it's with OCD, depression, anxiety, or bipolar.
I love that you brought up that whole media point, because it's been a recurring theme throughout this month. I've been doing some community chats with our partners at AMHC. And
Yeah.
it's true. I mean, even for those of us who don't necessarily have a mental health diagnosis or an issue, you know, I know personally, I got to like week 2 and I was like, oh my, information overload, and who do you trust? And, you know, finding that one source of reliable information that you know you can trust, I think it's imperative, and especially as this continues on and on with.
Yeah, it is. And I was the same way. I was watching, I mean, literally every day. And then finally I noticed that I was either getting upset or, you know, I was getting more anxious. And I say, you know what, I can't do this. So I literally shut down. There's the news. I only listen to one. It's only for 30 minutes and I get all the information. I go on the CDC website. And our organization are pretty good about giving us updates, and I just stick with that. And since I've done that, it actually has brought down a lot of the fear and anxiety, and I think it will work well for others.
Yeah, I definitely noticed a substantial drop in my stress levels once I started kind of being much more discerning about what I was taking in, because yeah, it can be way too much on a good day, and then
Exactly.
throw in, I mean, everybody's talking about it, so you really can't get away from it anywhere. It's really everywhere.
I actually
ahead.
wanted to bring up something that we have noticed is patients are afraid of coming in to get seen, whether it's for mental health or physical health. And I do encourage them that it is safe to come inside our, you know, our facility or their provider's facility. They can call ahead of time. What we don't want to happen is if they have a chronic medical condition or mental health, is to wait to seek care, which will lead to, unfortunately, being hospitalized for that.
For sure. And I think that leads well into our final question, which is really, you know, how have you guys had to adapt some of these mental health resources in the practice to accommodate, you know, social distancing guidelines that are currently in place? And, you know, have people been okay with changes? Has it been taking off? Are people appreciating it? I know some of it is telehealth. So why don't you tell us a little bit about how all that's going?
Well, what we did initially is visits that are not urgent, you know, like your annual physicals, were rescheduled, and we did introduce telehealth. We also have what's called a virtual check-in. The virtual check-in are for individuals who don't have access to a laptop or a computer, and that's a telephone conversation. Patients have adapted to telehealth. Some love it. Others are like, well, you know, I kind of miss seeing someone right there, which is okay. Again, this is temporary. And once we start seeing patients to our full capacity, you know, they will be able to enjoy that. But introducing the telehealth within our practice have made a great difference.
Yeah, and I'm sure, you know, we're so geographically spread out here in Aroostook County that I'm sure people really do value that time, even, you know, even with our primary care providers, just in front of another person. And one thing I've really been encouraging, you know, everyone that I've been talking to is, you know, as we go about our day, and we're kind of, some people are, most of us are still staying inside as much as we can. Being that light, you know, smiling and waving to people, because you really honestly don't know if you're going to be the only smiling face that those people see. And, you know, I've even shared in past videos, I'm like crazy in my car, oncoming traffic, and I'm sure they're thinking like, what is with this lady? But it's, you know, it's, you just never know, you know, having a brief hello moment with someone while you're walking into the grocery store, or, you know, however you're able to connect, those smiling faces are very, very missed in our community. And some people are not seeing people for days in the midst of this. And I'm sure some of these mental health issues are even more isolating. So as we wrap up, do you have anything else you'd like to add, or anything that You don't feel got covered?
Well, I hope everyone stays safe. Again, practice social distancing, and if that's not possible, wear your mask, especially where, you know, if there are signs to wear a mask. It's not necessarily to protect, you know, the individual, it's more to protect others. And we just have to be mindful, we have to be kind, we have to be respectful. I know everybody, you know, they have their opinions about whether to wear a mask or not and things like that. But the bottom line is this is a public health care crisis. It doesn't have anything to do with freedom, liberties, or anything like that. It's literally our health. And that's what we're concerned about. And that's what we want to keep everyone safe. And, you know, thank God in Aroostook County, we have a low number compared to other places. So everyone stay safe, give air hugs or elbow, no more handshakes. And I think we all will pull through this. Even though we're apart, we'll always be together.
For sure. Well, thank you all for joining us for Wellness Wednesday Live. We hope you'll check back in with us the second and fourth Wednesday of June. Our theme for June will be men's health. And thank you, Dr. Sam, for being here today. We appreciate it.
Thank you very much.
Have a great day.